This presentation will help you learn how to care for a patient with Alzheimer's disease. During this presentation, you will identify common signs and symptoms of Alzheimer's in the early and late stages, identify medications used in the treatment of Alzheimer's, be able to educate the patient and their family on the disease and treatment, and provide alternative therapies to help the patient and caregiver cope with the disease. This presentation will follow the story of Sandra Andrews. Sandra is a 70-year-old female who was just diagnosed with Alzheimer's disease by her primary care provider. Her daughter Jillian is her primary caregiver. Today, visiting nurses are coming to assess Sandra and her daughter's knowledge of her disease and medications. Before we meet Sandra and Jillian, it's important to go over what Alzheimer's disease is. It's characterized by a progressive loss of brain function and affects memory, cognitive function, and behavior. It mainly affects people over the age of 50, and some of the signs and symptoms that you can see are memory loss, confusion, and dementia. There is no known one cause for Alzheimer's disease. 10% of cases are genetic, but that doesn't make up the majority. Some possible causes or risk factors include chronic diseases such as hypertension, diabetes, stroke, depression, and other cardiovascular diseases, chronic inflammation, environmental factors such as smoking, immunologic factors, nutritional factors such as obesity or a high BMI, and also viruses. Alzheimer's disease is typically diagnosed by exclusion. The only 100% way to know if a patient had Alzheimer's is by doing an autopsy. When assessing a patient, it's important to look at their signs and symptoms. We can also do diagnostic tests to look for signs of Alzheimer's disease. The first test is a lumbar puncture. You'll take a sample of the CSF fluid and look for levels of protein. In Alzheimer's disease, protein is decreased. The second test is an MRI to look for structural changes in the brain. You'll see amyloid plaques and neurofibrillary tangles, and you'll also see that the hippocampus is atrophied. Now that we know an overview of Alzheimer's disease, it's time for our nurse Julia and her student nurse Michaela to go meet Sandra and her daughter Jillian.
Yeah, they're gonna, oh, I think they're here, okay. Mom, someone's at the door.
Oh, you better go get that.
Hello.
Hi, I'm Julia, this is Michaela.
Hi.
This is for Sandra.
Yeah, I'm Jillian,
Hi.
I'm her daughter.
Nice to meet you.
Hi.
Nice to meet you.
Hi.
Hi.
My name's Julia. I'm going to be your nurse today. This is Michaela. She's a student.
Oh, okay. Well, sit down, ladies.
Thank you.
So Mom, do you remember why they came to see you today?
It's for my
your new diagnosis. Do you remember what it was for?
is it for my stomach bug?
No, your Alzheimer's, remember?
Oh, okay.
Yeah.
I do remember.
Yeah, so you were just diagnosed with Alzheimer's. What it is, it's the progressive loss of brain function. So you might experience memory loss, confusion. It mostly affects people over the age of 50, and it affects your memory, cognitive function, and your behavior.
So what exactly caused this specifically?
It could be genetic, family related. Also, it's associated with chronic diseases such as high blood pressure, diabetes,
Yeah.
stroke.
She has that.
I have the high blood pressure.
Oh, okay, yeah. Also, there's some environmental factors like smoking. You ever smoked?
Yes, I have for like 50 years.
Now that our nurses have met the patient and gone over what causes Alzheimer's disease, it's time to learn some of the signs and symptoms. In the early stages, patients may have impaired memory, specifically their short-term memory, and also impaired judgment. They may be confused and disoriented and not be able to recognize their family and friends at times. They may experience mood and personality changes and also an increased level of anxiety. In the late stages of Alzheimer's, there's increased memory loss and confusion. Patients have a shortened attention span. They may also have difficulty with language as well as organizing their thoughts and thinking logically. It's hard for them to learn new behaviors and cope with new situations. They may at times become aggressive, especially at night, which is called sundowning. Patients may also go through periods of depression and psychoses as well as anxiety. Patients may also experience weight loss because they forget to eat or they lose interest in eating, and eventually they will lack bladder and bowel control. In the next clip, Julia and Michaela will talk with Sandra and Jillian and assess to see which of these signs and symptoms Sandra is currently experiencing.
So, Miss Sandra, since your diagnosis with Alzheimer's, have you experienced any symptoms like confusion or forgetfulness?
Well, sometimes I put down my glasses and I just can't find where they go. I leave them somewhere and then I can't find them 5 minutes later.
But Mom, I said that we should start putting them in the same spot every night. We put them right here, and every morning you forget, right?
You're right, Jilly, you're right.
Yeah.
Forgetfulness is a symptom of Alzheimer's, along with impaired memory, especially short term, so forgetting things that you did recently. Confusion and disorientation. Do you ever feel like lost? You don't really remember where you are?
Well, Michaela, sometimes when we're leaving the grocery store, she gets a little confused, and I have to reorient her on where we're going. The other day we were at my aunt's house, her sister, and she kind of didn't really recognize my cousins, so that was a little hard to deal with. But it started with just minor forgetfulness, and I feel like it's getting progressively worse.
You're afraid that your mother's getting worse, so let me give you some signs and symptoms so you can identify if your mother's Alzheimer's is in fact progressing.
Great, thank you.
You'll notice increased memory loss and confusion. Her attention span will begin to shorten considerably. She'll have trouble with language, judgment. She'll be a little bit disorganized with things and thinking logically.
It'll be hard for her to learn new things and cope with new situations. She may become aggressive at some point. You may get mad, especially at night.
You won't get mad at me, right, Mom?
No. Never, Jilly.
Oh,
Yeah.
Depression is a symptom sometimes, so feeling sadness, anxiety, weight loss, and lack of bladder and bowel control, but that's in the later
okay.
stages.
Is there anything we can do to slow the progression of this disease? I mean, I try to keep her brain active. We do the crossword puzzle together every morning in the newspaper, but I just want to make sure that she stays the way she is as long as possible.
Yeah, it's good to keep the brain activity going, trying new puzzles or crosswords, stuff like that. Keeping a sane routine is good too.
If you are in situations where she is feeling forgetful, you can just gently reorient her and give her a little bit of cues just to help her out, but still gently ease her into remembering. Don't try to be aggressive about it. Just do gentle reminders. That'll really help her be reoriented to the situation.
Great. So we'll have to get some puzzles, Mom.
Awesome, I love puzzles.
Great.
After Julia and Michaela's assessment, Jillian has questions about a new drug that her mother has been prescribed. It's called donepezil or Aricept. It's commonly used in the early stages of Alzheimer's to slow the progression of the disease. It's a cholinesterase inhibitor, meaning it prevents the breakdown of acetylcholine and enhances the transmission in the neurons. This medication should only be used for 12 months. It should be given at bedtime on a regular schedule. The patient can also take it with food or specifically milk to decrease GI upset. Some adverse effects that you might see are nausea, vomiting, dizziness, headache, abnormal dreams, irritability, and darkened urine. And sometimes you might see CNS depression, so you have to watch your patient's airway. This medication is contraindicated in people with liver disease or liver failure because it's hepatotoxic. Patients will need regular blood work to check on their liver function tests. You also don't want to give this medication to anyone who has an active GI bleed. Should an overdose occur, you'll see symptoms such as severe nausea and vomiting, sweating, salivation, hypotension, bradycardia, convulsions, and increased muscle weakness. In this situation, you want to give atropine to correct the situation. When donepezil or Aricept is no longer effective for patients, there is another drug that can be used. It's called memantine or Namenda, and it's approved for the later stages of Alzheimer's. It reduces abnormally high levels of glutamate in the body. Some adverse effects that you might see are progressive weakness, visual disturbances, mood alterations, and cognitive deficits. You should use caution in patients with hepatic or renal failure because it can be toxic to those organs.
So since we have like a good routine going here, I'm her primary caregiver. I'm here all the time with her, and we're doing puzzles and stuff. Do we not have to take the meds that the pharmacist gave us then?
No, I recommend taking the medications. Do you have them with you?
Yeah, I do have them. I just don't really know what they're for or what they do. These are the two that we have.
So this one is called Aricept. It is an Alzheimer's disease drug. What it does, it's used in the early stages of Alzheimer's and it slows the progression of the disease. Michaela, do you want to tell her some of the adverse effects and when to take it?
Yeah, so you need to make sure you take this medication before bedtime and on a regular schedule, so take it every day. Things that you should watch out for if you're experiencing nausea and vomiting, dizziness or a headache, strange dreams, irritability, or dark urine, you should let your nurse or your doctor know. You may also experience like fatigue as well when you're taking this drug.
Mom, do you have any questions about the med?
I don't think so yet. No.
Yeah, so with the puzzles and the Aricept, I think we're pretty golden then.
Mm-hmm.
Yeah.
So just a little teaching. So you're supposed to take this with food or milk so you don't have an upset stomach, and make sure you take it as prescribed and on a daily routine, so same time every day.
We can do that.
Yeah, we'll have to set up a schedule for you. Maybe we can get a pill box so we know that we should take them, that we take them every day.
Oh, good idea, Jill.
That's a very good idea. And if there is an overdose, you do end up taking too many, some of the signs and symptoms are severe nausea and vomiting, sweating, salivation, low blood pressure. Your heart will feel like it's beating slowly, convulsions, and increased muscle weakness.
So do I have to take this medication every day now for the rest of my life?
No, this medication is only for the early stages. You will take it for 12 months, and then after that you'll take what's called Namenda. It's for the later stages of Alzheimer's, and it's approved for the treatment of severe Alzheimer's disease.
So does that mean that after 12 months she's guaranteed to get worse, or is that just how long that you can take the medication for?
Well, this is a progressive disease, so she will continue to decline. The Aricept is used to slow the progression, but you can't delay the inevitable. So
Okay.
once that starts to occur, when she starts declining more, we can switch to Namenda to try to delay it even further, but that's pretty much only treating like severe Alzheimer's.
Okay.
But the progression is different for every patient. We can't know specifically how long it will take.
All right.
And then things you should watch out for once you switch to Namenda are progressive weakness, visual disturbances, mood changes, and cognitive deficits.
And you should take this cautiously if you have hepatic, which is your liver, or kidney toxicity.
Do I have those?
No, you're good. You're good.
Alzheimer's is a disease that not only affects the patient but their family as well, so it's important to teach caregivers strategies to help manage the patient's disease. The number one intervention that you want to teach is to make sure that the patient's in a safe environment. You want to make sure that you try and prevent any falls that you can. So you can do things such as turn the lights on or keep the room organized. You also don't want to overstimulate the patient, so maybe limit visitors to only one or two at a time. You have to find methods that work for the individual. That might be listening to music or looking at photographs when they get agitated. You also want to find a routine that works for them, and it'll help give structure in their lives and keep them oriented. You also should encourage exercise because it will keep them active and tire them out so they'll sleep well at night. And you also want to ensure that they're getting adequate nutrition and hydration. The nurse should also support the caregiver because managing this disease can often become tiring and stressful. They can suggest support groups so that caregivers can share their experiences with people going through the same situation, and they also can suggest respite care, which will come and watch the patient for a few hours to give the caregiver a break. Should caregiving get too stressful for the individual, they can provide information on care facilities that will be better equipped to handle the patient's disease.
I'm sorry, I just need a minute.
So Sandra, I saw that you had a really pretty garden outside. Do you want to give me a little tour?
Oh, I would love to. You're gonna love it.
Oh, great.
Right out here.
Okay.
So Jill, I know this is a difficult time for you, and it may get worse. I just want to talk to you a little bit about how to keep your mom safe. It's important to keep the lights on and rooms organized so she doesn't get disoriented and could fall. You don't want to overstimulate her, so it would be best to keep it to 1 to 2 visitors at a time if people are coming over. If she does get agitated, you can play some music or look at old photographs to help her.
Yeah, she likes that.
And like I said before, having a routine to give structure in her days. Exercise is very good, so maybe going on walks.
Yeah.
But I would keep it to the same path every time so she doesn't get confused.
Never alone.
No, never alone. Adequate nutrition and hydration, so eating the right types of foods and drinking a lot of water.
Yeah, it's just a lot to take in, and I'm with her every day, all day. I see her getting worse, and it's just hard. It's hard to deal with, like, on your own. And she doesn't know. She's very unaware that she's getting worse, and she doesn't really see the effects of it. So it's hard.
Yeah, there are support groups for you that you can go visit. People who are going through the same thing as you, they can talk to you about it. If it does get worse to a point where you don't think you can take care of her on your own, there are facilities that can care for your mother when you can.
Yeah. Thank you. Thank you. You again. I really appreciate
I hope
it.
you liked the flowers,
You
Michaela.
have a lovely garden.
Oh, you
Oh,
showed her all the flowers,
I
Mom?
did,
Oh,
I
good,
did.
good.
This is it for our meeting today. Do you have any questions?
Do you have any questions, Mom?
I don't think so, Jilly. Do you?
No, I think we're okay.
Okay, we'll be back again soon, okay? Thank you so much.
Thank you.
Thank you.
Bye.
Bye.